Thank you, Madam Speaker. Minister Sachs, thank you so much for being here today. I want to add my words of welcome. This is your first visit to the Chamber since your appointment as a Minister of Mental Health and Addictions, and I really appreciate the wide range of issues you have covered. I also know well the work you have done before politics to create dialogue across communities, and I have great respect for that work that you have done and continue to do. I think I may be the last questioner, but as we get to the end of this hour, I wonder if you could just summarize for us what your priorities are, given the wide range of very pressing issues around mental health and addiction. What are your top priorities?
Madame la Ministre.
Thank you for the question. I would say first and foremost, it is not lost on me that for nearly every household in this country, the illegal, pervasive, and poison toxic drug supply is increasingly becoming more apparent in many more communities, both in our urban centers, but also in our rural communities. That is top of mind for me to ensure that we continue to offer services and supports to supplement the health jurisdictions in each province and territory in making sure that those who use substances have access to health services, that we reduce stigma and get people to the health care that they need. I would say that my second priority, as wisely mentioned by Senator Kuchar, is mental health literacy. We need to ensure, starting with our youth, we need to ensure that we have upstream prevention services and supports, such as the integrated youth services. We will also be investing in the Icelandic model this year in 7 locations throughout the country, because we know that if we want to stop the cycles of mental health struggles, but also those of addiction, then we need to ensure that our young people are getting the health services that they need when they need them at an early age to create that safety net of prevention.
Senator Cardozo.
Thank you. And if I can just ask you about the other part of your portfolio, the Associate Minister of Health, whether there's any time left to deal with that part of it and other issues you deal with, and also overall, if you can say a few words about your interaction with the provinces, because ultimately it's them who is providing the services.
Absolutely. I think at this time, as the Associate Minister of Health with Minister Holland, it's important to have a woman's voice at the table, particularly when it comes to sexual and reproductive rights and health access at this time. Those rights are our health services in this country, and I fully intend to see them stay that way. With our provincial jurisdictions, I will always strive to ensure that we have a collaborative approach when it comes to the opioid crisis and the overdose crisis that we're seeing. Not all jurisdictions are on the same page of the interventions that are needed, but we are all on the same page in the priority of saving lives. I have engaged in dialogue throughout my career. I don't.
Merci, Madame la Ministre.
Thank you.